What is truly the difference between complex dissociative disorders, and why don't we identify which one we have? Before we get into it, let's talk about what complex dissociative disorders are. Complex dissociative disorders are dissociative disorders that feature the presence of parts. We will be referring to these as alters. These parts are formed from structural dissociation due to childhood trauma, which we are planning to go into further in another video. You can learn more about the terminology we are using in our basic terminology video, which we will make sure to link for you. Let's start with the disorder that is most well known, Dissociative Identity Disorder. In the DSM-5 TR, the first criteria is listed as disruption of identity characterized by two or more distinct personality states. This is what we refer to as alters, these being distinctly different identities that can switch with each other and control the body and be aware of what is going on out here at different times. The second criteria from the DSM is amnesia. This can be for everyday events, important personal information, and/or traumatic events. The amnesia is not required to be between alters. The ICD-11 elaborates on this in stating more clearly that alteration between distinct personality states is not always associated with amnesia. The amnesia is also not required to be complete blackout amnesia. Grayed-out amnesia would still qualify one for a diagnosis. Then we get into the exclusion criteria, which will remain the same across all complex dissociative disorders. These symptoms are not a part of a broadly accepted cultural or religious practice. They cannot be the result of substances or other medical conditions. In children, they cannot be better attributed to imaginary friends or fantasy play. And these symptoms must cause distress or dysfunction. Distress and dysfunction being one of the things that we see the least understood within the community. Distress and dysfunction are two of the 4 Ds that are used to diagnose and define psychological disorders. The other 2 being divergence, or being different from the norm, and danger to oneself or others. At least 2 of the 4 Ds must be present for the diagnosis of a psychological disorder. The thing is that dissociation and the presence of alters in and of itself can serve to hide the presence of distress and dysfunction. Also, sometimes those with complex dissociative disorders notice the distress and dysfunction more from comorbid disorders such as CPTSD or PTSD, both strongly associated with these disorders. Denial and minimization are also common in these disorders, which may lead those who are experiencing distress and dysfunction to not label their experiences as such. It is also important to note that there are people with these disorders who the DSM would label as high functioning, who are able to function very well in many aspects of life despite the disorder, in which cases distress and dysfunction may be less evident. The next complex dissociative disorder we are going to be talking about is otherwise specified dissociative disorder, in this case OSDD-1. OSDD is a catch-all disorder for all dissociative disorders that do not meet the full criteria for any other dissociative disorder. There are 2 types of OSDD-1, one in which parts are less elaborate but amnesia is still present, and one where parts are elaborate but there is no amnesia present. If one experiences both the absence of elaborated parts and amnesia while still having the other symptoms of the disorder, they would typically be diagnosed with borderline personality disorder instead of OSDD. The last complex dissociative disorder in the DSM is Unspecified Dissociative Disorder. This diagnosis is used in emergency situations where full analysis of symptoms for diagnosis is not possible. This diagnosis will typically be changed to the diagnosis that better fits the individual symptoms once they have been identified. The final complex dissociative disorder that we will be discussing in this video is Partial-Dissociative Identity Disorder, which only exists in the ICD-11. This disorder is distinct in the fact that it focuses on the presence of a dominant front-bound host. In this disorder, there is one dominant identity which is described as being intruded on by less dominant identities. These less dominant identities usually do not take executive control of the body, with experiences of such being fairly transient. It is rare for there to be any amnesia present with this disorder. So, to answer the question at the beginning of the video, why don't we identify with a specific one? First, it is important to note that these disorders occur on a spectrum, and people can move along this spectrum during discovery and recovery. It is not uncommon for OSDD systems to discover more elaborate parts or amnesia that they were not initially aware of. And also in reverse, it is not uncommon for DID systems to reach a place in recovery where they no longer have elaborated parts or amnesia. Due to the fact that it is a spectrum, in some cases it can depend on the doctor who is diagnosing as to which complex dissociative disorder is diagnosed for the individual. Different doctors define the line of where amnesia or elaboration of alters is enough at a different place. And there are those near the middle of the spectrum that are harder to diagnose as far as which complex dissociative disorder they have. We personally prefer to view complex dissociative disorders as that spectrum than individually for this reason. Currently, we are medically recognized and being treated for OSDD1, but we have been uncovering amnesia during therapy. We sit in a very gray area with our experiences right now, and don't wish to clarify and be wrong when just saying that we have a complex dissociative disorder works just fine. Hopefully all of this made sense, and if not, feel free to ask us any questions in the comments down below. You can like the video if you liked it, and subscribe and check out our other videos if you want to see more content like this. If you are interested in learning more about the terminology we use, as we mentioned at the beginning of this video, we have a basic terminology video which you can find here. Or if you want to learn more about complex dissociative disorders, you can find our educational playlist here. Thank you for watching. We hope you have a great day, and see you in the next one.